Okay, this person asked, would the dialysis take the blood pressure too, or was this a decision based on pros versus like cons? So, yes, dialysis can tank blood pressure, but the dialysis in this specific picture that I'm talking about is called CRRT, or continuous renal replacement therapy. And it is a more gentle form of dialysis. So in traditional hemodialysis, dialysis can remove like 2, 3, even 4 liters of fluid in like a 2-3 hour time span, which is a huge volume switch in patients, right? So, and someone that's on 4 vasopressors, this would not be a smart decision by any means. So, a lot of times we will do continuous renal replacement therapy, or CRRT, which is a very gentle form of dialysis. It runs continuously over a 24-hour period, and we can remove no fluid. We can remove 10 cc's an hour, 50 cc's an hour, 200 cc's an hour. So it's very, very gentle and mild in comparison. So you don't necessarily see this huge blood pressure change. Now, I will say that sometimes when you initiate the CRT and actually begin pulling the blood out of the patient, you might notice a little bit of a drop in blood pressure. So you usually are prepared for that. But actually, another thing is I usually see the opposite in blood pressure, in the sense that when patients go on CRRT, over time, hopefully you see the blood pressure improve, because a lot of these patients are acidotic, and so that can cause their blood pressure to be lower. It causes the vasopressors not to be able to bind as well, and so they're not working as well. And when someone goes on dialysis and it cleans the blood, you should see their pH kind of come up a bit and normalize, and so then you start to see those vasopressors work a little better, their blood pressure gets a little better. Hopefully you can come down on the vasopressors. If this is not happening, usually the patient is too sick, and you already know the direction that this is headed in. So yes, that is a long answer to your question, but hopefully that clarifies things.